welcome everyone. For those of you who have joined us for the Macquarie University Postgraduate Showcase, my name is Kira, as I mentioned, and I am a Macquarie University Student Ambassador, but I'm also currently completing the Doctor of Physiotherapy program, and I'm in my second year. So tonight you'll learn about the fascinating myriad of careers that you can pursue through the postgraduate degrees within the field of medicine, health, and human sciences, and why you should study with us. So the study journeys and experiences and insights will also be discussed from our current alumni students and current students, and you'll also have the chance to ask the speakers and the panelists your burning questions. So without further ado, I'm pleased to introduce our first speaker, Professor Cath Dean, the Deputy Dean of Education and Employability from the Faculty of Medicine, Health and Human Sciences. And for our audience, please put any questions if you have them for Cath in our Q&A box. So Cath, a very big welcome to you.
Thanks, Cara. I'm just going to share my screen. Okay, thank you very much everyone who's joined us. I'd also like to acknowledge the Watamatical clan of the Darug Nation, whose traditions and cultures have nurtured this land since in Dreamtime, and pay my respects to elders past, present and emerging, and also welcome any Indigenous guests joining us today. I'm delighted to be here to present some information about our postgraduate courses in our faculty, the Faculty of Medicine, Health and Human Sciences. I think it's a very special place to study. Macquarie University is ranked among the top 1% of universities in the world. We're really Australia's first university to have a teaching hospital on campus, and we also have fantastic resources in our hearing hub located also on campus. So I think it's a very good place to study. We have an academic health sciences centre that's called NQ Health, and its core purpose is encapsulated in 3 words: heal, learn, discover. The MQ Health, our Academic Health Sciences Centre, is made up of 2 schools, the School of Medicine and the School of Psychological Sciences, and 3 departments: linguistics, chiropractic, health sciences. And we have a research institute, the Australian Institute of Health Innovation, which is a powerhouse of leading research in implementation of health systems research and improving health outcomes for both nationally and globally. If we think about our faculty, which is part of NQ Health, we can think about our courses and how they're connected. We have really some broad academy of courses, which don't necessarily direct you to a particular career, but can help you work out, if you're not sure what you might want to do, work out where your strengths might be or where your interests are. We have a whole lot of undergraduate courses in our pre-professional academy, which set you up for postgraduate health studies if that's where you want to go, but are also an endpoint in themselves, and you could enter the work and have a professional career straight out of our undergraduate course suite. And then we have a professional academy, which has 9 health courses, but also it has a significant suite of courses in linguistics and translation and interpreting. So our courses are kind of listed on this slide, and I won't go through them all. Probably some to point out though, which are new, is our Bachelor of Exercise and Sports Science, which is a new offering that we've started this year. And the other new offering in the Broad Academy is a Graduate Certificate of Clinical Trials Operation, which is something that we will be starting out next year, our first intake in 2024. But otherwise we have different courses that fit into these categorisations. If we think really around health courses, we can think that the Broad Academy is really made up of our Masters of Public Health, and part of that that's a coursework, 2-year coursework Masters, but it also has an option to do a research component in the 2nd year that's equivalent to the Masters of Research. And the Graduate Certificate of Clinical Trials is another kind of Broad Academy course. Otherwise, we have 9 postgraduate health courses, which will allow you to enter the profession. So Doctor of Medicine graduates enter the workforce as interns. The Doctor of Physiotherapy allows graduates to work as physiotherapists, same with chiropractic, clinical audiology, speech and language pathology. And then we have a suite of postgraduate psychology courses, so clinical neuropsychology, clinical psychology, org psychology, and organisational psychology, and professional psychology. And then in linguistics, our real broad academy course is really around editing and electronic publishing that we offer. And then we have some professional courses in teaching English as a second language, so teaching English to speakers other than English. So that's the Graduate Certificate of TESOL and Applied Linguistics in TESOL at master's level. And then we have a series of nested courses that are really in translating and interpreting. With our strength in hearing and the Australian Hearing Hub, we offer, a course, a graduate diploma in Auslan English interpreting as well. So there's lots of opportunities to come to Macquarie for postgraduate study. And there are 6 clear reasons why I think you should come to Macquarie if you're contemplating postgraduate study, particularly in the health space. I think we create an exceptional learning environment being in MQ Health, where our students get to learn where, in part of a real health service. We have fantastic new facilities. Our facilities in the health sector have grown over time in the last decade, and they're state of the art. We're very student focused, student centred. Our curriculum is really outcomes based to not only meet professional standards, but to extend your capabilities so that you are a future focused professional. We also have clear pathways and rewarding careers in health and linguistics through our undergraduate, postgraduate pathway, so a connection between our pre-professional courses and our professional academy, and we have industry relevant courses. So exceptional learning ecosystem. We have our own. We operate our own MUH hospital, so the Macquarie University Hospital and Clinics. We also have private clinics in the Hearing Hub and student-led clinics in the Hearing Hub in psychology and speech and language pathology and audiology. We also have partnerships with New South Wales Health, so a range of our students will go out on placements into a number of New South Wales Health hospitals and clinical facilities. We have international partnerships as well, so one of our major partners in the medical degree is the Apollo Hospital Group in Hyderabad, India. We also have industry partners with Cochlear. We have, many partnerships with our health courses with a range of private, public and education providers. So really anywhere our graduates could work, we've got partnerships there for our students to do some work integrated learning. Our facilities are state of art. They're purpose built to provide optimum opportunity for the students to learn. So these are some slides of our facilities. The physiotherapy setup was designed as authentic learning environments. We have one teaching room that's kind of set up as a rehabilitation gym, another as a private clinic. We have these fabulous teaching rooms in the clinical education building, which are like the Harvard case study room, so really good opportunity for discussion. We've we have a learning circle with Wollongongo, our partnership with Indigenous Australia. We have our PVC Indigenous and Wollongongo unit to support our students. We have fantastic facilities for hearing and audiology as well, and speech pathology. The other really good reason to study is we have relatively small cohorts in the postgraduate space, which really allows you to have really tailored and personalised education. You're actually known, you actually get to know your cohort and your teachers. So it's a wonderful place to learn and grow and form some really deep friendships with your peers. The curricula that we've designed in all our postgraduate courses is outcomes based. We use a capability framework to define those outcomes, and we're really trying to provide tasks that will try and develop students' capabilities to really be future focused. So some examples is students complete research projects and they can present them in research posters like at a conference, or they can do a elevator pitch and a video for a new business, and they have to do a business case and the pitch for that. We also work with students to develop their LinkedIn profiles and also try and tailor their communication skills for the audience. So some of the activities might be writing, a blog for a private practice in a health profession. We do have clear pathways to a rewarding career in health. So you can start as an undergraduate student straight out of school and come into our pre-professional courses and then straight into a health career, or there's an option to enter at the postgraduate area as well. So for example, Bachelor of Clinical Sciences is our fast track bachelor degree that prepares you for a range of courses. It's fast track in that it's a 3-year degree that's kind of been condensed into 2 years. So it meets the requirements of a 3-year bachelor's degree, but we've set it up to accelerate the study in 3 years, and that provides coverage of the prerequisite requirements for the Doctor of Medicine, but people could choose to go into the Doctor of Physiotherapy, the Master of Public Health, or Public Health Research, or thinking about maybe a research degree, or we could add to this figure, from next year, it would be a good preliminary course to study for the Graduate Certificate in Clinical Trials Operations. In the linguistics area, our Bachelor of Speech and Hearing Sciences really prepares students to cover all the prerequisite knowledge criteria to allow for entry into the Masters of Clinical Audiology and the Masters of Speech and Language Pathology. And we also have a suite of psychology courses that can lead to the requirements you need to enter postgraduate psychology. Our courses do have industry relevant courses. We do have a significant component of work integrated learning where you get to practice in clinics, not only in our own MQ Health and the clinics that we have here and the hospital here, but also with our partners in public and private sector, as well as education, disability sector, depending on your course and to an extent your interest. We can tailor some of your clinical experiences and placements to have you well set up for an industry relevant course. We also have advisory boards with representation from industry people on our advisory boards to help ensure that our courses are well designed. We even have alumni that work for us as well. So some of our graduates are working in our own health service. So on the slide on the left is Bridget Dean, who was actually one of the first cohort of our Doctor of Physiotherapy degree. She's actually worked in MQ Health since her graduation, and she's now a senior physiotherapist in the clinic and providing lots of care in some of the innovative osseointegration and amputee work, as well as general outpatients. And then, on the right is Dr. Jordan Griffiths, who was in our first cohort of Bachelor of Clinical Sciences, and she's exceptional in that she topped clinical sciences. She got entry into our Doctor of Medicine degree, which she also won the university medal for that, and she's actually working now as a resident at Westmead Hospital in her second year of practice. So there is a way that you can we stay connected with our alumni. We want to form lots of bonds with our alumni and expand our reach across the area. So look, I'd really welcome you to participate in this webinar. If you've got questions, put them in the Q&A chat, in the Q&A box, I think. And also, if you're really looking for further information, ask.mq.edu.au is really where you should be seeking information. Thank you. Without further ado, I'll stop the share and come back on.
Thanks, Cath. So we've had a question from our audience. So I think it's about applying for a Master's of Research. If a student already has a Bachelor of Science, but it's not the clinical science degree, are they eligible to apply for a Master of Research?
So our Master of Research is actually a 2-year course, and it's a bachelor's qualification will allow you to enter into that. And the first year of our Masters of Research program is really aligned with a Bachelor of Philosophy. It's more dedicated coursework in the area of interest and some experience. And the second year of the MRes is really completing a small research project. And if you perform well in that project, then you can articulate, or you'll complete your Masters of Research, but then you can go into continue into PhD studies.
Perfect. I hope that answered your question out there. Now, the second question, is it quite competitive to get into the clinical audiology program?
I think most of our health courses are a little bit competitive to get into. I think that's the nature of, there are some limitations in the size of our courses because of our placement capacity and a little bit of our desire to keep them small enough so we know our students well. I think all our programs are competitive, but I think there is actually some capacity, and we'll be looking to increase the size of our clinical programs over time, our clinical courses over time. It is competitive, but it's also relative to the cohort that you're applying for at the time. So as long as you meet the minimum criteria, admission criteria, I think you should apply, because you may not be competitive one year, but you might be the next, because it kind of depends on the people who are also applying at the same time.
Yeah, perfect. So around how many people, I don't know if you know this off the top of your head, but how many people do we take for the Masters of Speech and Language Pathology?
We take 40, but we're trying to increase it to 60. So that is increasing over time, and about a similar amount into clinical audiology. Our medicine program's a little bit bigger, and DPT's, our physiotherapy program's bigger. The main rate limiting step, or what limits our capacity, is, we want to ensure that we have high quality work integrated learning. And while we can provide some experience in our own health service, we want to be able to provide a breadth of experiences, and it's really on our partnerships and, with others. But, health workforce is in high demand. It's the area that globally we know it's going to increase over time. So it is, we're looking to solve that issue, and it's quite a common issue most universities are trying to solve as well.
And for our future students out there, for our postgrad degrees, how many placements do students tend to go on?
It depends very much on the course and meeting the professional standards that are really set by the profession themselves and the regulatory framework around them. Physiotherapy, because I'm a physiotherapist, they do five-week placements, but they also do some integrated part-time placements as well, and they also do some early clinical experiences right from first year. And that's a really important part. We actually try to provide opportunities for early exposure to the clinical environment and development of clinical skills, just to check it is what you really want to do. Because it's sometimes people might think that's what they really wanted to do, but when they actually get to practice some of it, they think, I don't really want to. And that's okay. There's lots of other opportunities and courses here at Macquarie that you might be interested to, change your career the way you might want to go.
For sure. Another question from our audience. Can you help me understand how a master's course would be able to be studied on a part-time basis? They are interested in clinical audiology.
Not all of them are allowed to be studied on a part-time basis. I'd have to check the handbook to see if we offer clinical audiology part-time. I know we have started to offer speech pathology part-time. It is something that I'm quite interested in expanding our capacity that way, because it ensures that we get more diversity of students involved. And I think that's great in terms of equity and better for the profession, better for the public, that we have more diverse group of people. And, you know, full-time study can preclude some people from actually completing the degree. We're working towards that. I know speech and language pathology deliberately in their course reaccreditation, their last course reaccreditation with the Speech Pathology Australia and course redesign did come up with a part-time pathway, and we're looking at seeing whether we can do that across other courses. The psychology courses at the moment are offered part-time, but I think that might be our limit, and I should know that, but I don't exactly.
That's all right.
So,
I think we'll have time for one or two more questions. So you touched on earlier that Macquarie is a big family in our health sector, and we've got, you know, the hospital nearby and all of these amazing facilities around us. So what are the benefits of studying, I guess, in a health degree, and how can we learn in this integrated environment? What are the examples that you have?
Well, I think students get to practice in our own health service. So and there's good evidence that, you know, health services that have research and education embedded in them are actually much better in terms of providing best practice in care. So it's actually really good. We have we partner with many of our patients and clients in helping us develop our future workforce. So there's a really nice response, but I also think it's just rich case studies and case materials that can be embedded into the curriculum. But you will have opportunities to work in our clinics, in our various clinics. So the psychology has a clinic, speech and hearing has a clinic. We have MQ Kids Clinic, which is embedded into the speech and hearing clinic. Physiotherapy are embedded into the MQ Health Physiotherapy Clinic, and they also do placements in the hospital. And the medical students are embedded, you know, from day one in. They have bedside tutorials and things. So it's a really rich place to actually learn where real clinical practice is occurring. And context is really important in the development of capabilities, but also helping a person grow personally to work out what do they like, what do they don't like, what they may not like. There's opportunities within health courses once you've met the entry-level standard to specialise into different areas. And if we can give a breadth of experience and you know, a little bit of safe experience early on through simulation or really guided experience within our own health service, we can help our students develop the confidence before they go out into other public-private providers.
Perfect. And one last question for any of our attendees online today, if they haven't done a health-related undergrad course or any health-related degree before, what advice would you give them if they're looking to pursue a degree in our faculty?
Well, it really depends which course that they'd like to do, and because there are some requirements that are actually prerequisite knowledge requirements. So in chiropractic, I think, and in physiotherapy, there's requirements about anatomy and physiology, human anatomy and physiology, and maybe research methods as well. So usually they may have done some work, depends what course they've done. I don't think it precludes coming and doing a health course, but it may mean that you need to do an OUA or a miscellaneous unit to cover prerequisite knowledge area, or it may mean doing you know, a one-year course that covers those areas and just trying to find what matches. But that's where you really need to do some work about knowing what are exactly the admission requirements for the course that you're seeking admission to, and making sure you cover your bases. And the faculty would be providing some advice, or you can double check some things if you're serious about it as well.
Perfect. Thank you very much, Cath, for your insight. And for anyone who has any other burning questions, please don't hesitate to contact the university. We are offering our one-on-one consults. So as you can see on the screen here, if you scan the QR code, it'll take you to our consult page. But yeah, thank you very much, Cath. So we'll now get started in our second session, which is sharing our student insights into our degrees. So like I said earlier, if you've just joined us, my name is Kira. I'm studying a Doctor of Physiotherapy and I'm in my second year. And I would like to welcome some of my current students in our big medicine and health science faculty. So they'll be sharing their personal study journeys and experiences. So if you have any questions for any of us, please feel free to put them in the chat function below, and we'll open the floor eventually up to the Q&A a little later in the session. So I am pleased to introduce from our Masters of Public Health, I have Ben Kramer. From our Master of Chiropractic, I have Cooper May. From the Master of Speech and Language Pathology, I have Rachel. And lastly, from Master of Clinical Audiology, I have Amanda. Perfect. All right. So like I said earlier, if you've got any questions for us, please put them in the chat function below. But first of all, I'll kick off our sort of student insights by sharing some of my personal experiences and my journey currently in the Doctor of Physiotherapy program. So basically the degree is a 3-year extended master's degree, and something that we do in the first year is we look at our foundational units of physio with a particular focus of cardio resp and neurological physio and musculoskeletal physio. And then in the second semester, we build on these units and we go into more depth in these units. And I guess the first year is really practical. It's very exciting and we get involved a lot. But something that I really like about the first year is that you complete some units with the Macquarie MD students, so the students studying medicine. And it's amazing because we get to pair up with them, go out into the community and learn from our peers. And it's great because we're starting to develop these relationships with our future allies in health eventually. So yeah, we get to learn from them, which is super cool and super unique to Macquarie. And then as we move through the degree, we also have a bunch of clinical placements that we're completing. And this is, I guess, in our second year, which is where I am now, we start putting what we're learning into practice from what we learned into class. And yeah, this is where I'm currently. So I'm got a whole bunch of placements coming up, which is super exciting. And then something that I can look forward to next year is our research project, completing some business units, which is super cool and unique to Macquarie, and more complex cases. So that's just a bit of a snapshot of what the student journey looks like in the Doctor of Physiotherapy program. So I'm going to throw to Amanda, who's studying a Master of Clinical Audiology, who's going to share some of her student perspectives and insights. Thanks, Amanda.
Sure. Hi, everyone. Yeah, I'm in my second year of the Masters of Audiology. It's a 2-year course. I love it. I love it. So I'll be out next year. So I'm definitely looking forward to getting a caseload. I think one of the things that has been probably different about doing a master's as opposed to the undergraduate and doing it at Macquarie is, as Cath mentioned before, the smaller cohort. I found that really great. I've really gotten to know the professors, which I never got to know them in the undergrad course, but I know everybody now. Everyone know, like the class members all know each other. We've just had an opportunity to go to the Northern Territory, a group of 10 of us. We went on like a research trip for 2 weeks with some of the professors, and we did audiology screening on some of the primary school kids up there for research. And that was a massive highlight. Not like it was a real learning experience, but very much a manageable one. Very practical, very hands-on, and it was also great to just get that camaraderie with all the other students and the professors. So yeah, did you have any other questions about audiology, Kiara?
Let me just check. We haven't had anything come through from our audience, but something. Pardon?
Sorry, I will just mention one of the questions before was about, is there a part-time audiology part? And at the moment, no, there isn't, which was hard for me at first because I have 2 kids, and certainly a part-time pathway would have been great. But I know that we've given them lots of feedback about that. So perhaps one day in the future.
Perfect. So I was wondering, Ben, if you could share some of the highlights and what life is like as a Master of Public Health student.
Yeah, I'd love to. Yeah, no, public health, the whole degree, like the whole experience has been amazing. Like it's been so great. I got to come clean. I didn't quite know what public health was until I kind of first started. And I kind of was like, oh, this sounds interesting. My undergrad was kind of philosophy, psychology. And then when I started, I was like, wow, it's amazing. So like, the first year public health, it's a 2-year degree. It's coursework, you got lectures, assignments. One thing I noticed, backing on from Amanda's point, is I really kind of got to know my lecturers quite well. They'd come up and say, hey, we've got this thing happening, or we've got this opportunity at the Public Health Association of Australia. They're looking for mentors, early career researchers, if you're interested in that. They also come up with really interesting assignments. So, in my undergrad, it was like, write this research report or this essay, but here it's like, write a policy brief directed to this Minister of Health, or direct a health promotion video, or write a health promotion campaign. So they're really quite practical about what they do and quite interesting, which I loved. So the second year, there are 3 kind of options you can do. So you can do a second year coursework, which is you just do more units. There's a second year professional practice, which is a 6th-month placement and then 6 months of units. Or there's the research pathway, which is what I'm doing. And that's basically like an honours year. So you just have 1 year where you do a research project. I'm looking at this thing called Play Streets, which is kind of a community physical activity kind of intervention. They're running a whole bunch in North Sydney, which is what I'm evaluating. So I've kind of been able to partner with them and reach out to them, which has been really great. And as well as that, just developing ties with the different kind of organisations around Australia and internationally that are doing Play Streets. Yeah, that's been a real highlight for the moment for this year.
Perfect. Thanks, Ben. Cooper, what is life like as a chiro student in the Masters of Chiropractic?
Oh, it's amazing to begin with. Thank you for passing the mic on. Lovely to meet all of you guys. My name is Cooper May. As I'm in my final year of my Masters, so it's done a 3-year Bachelor of Chiropractic, and then there's a 2 years Masters to that. When describing all the experiences I've had, over the last 5 years, 4 minutes essentially probably isn't enough to describe it all. With a 5-year degree, it brings so many memories that you'll cherish and think about for the rest of your life. When I first began, in the bachelor's, I really didn't know what I was going into. Classes 5 days a week, weekly assessments and quizzes, and enough content to sink a ship. But the thing is that what made this not only tolerable but actually enjoyable is the way you get taught at Macquarie. What I came to realise and very much value was there was a big emphasis on the practical component of learning. For example, the anatomy subjects within both bachelors and masters incorporated classes that involved not only fake kind of anatomy, visualized helps and whatnot, but actually the use of cadavers, being able to actually physically touch a human body, see where the muscles, the veins, the arteries go, really helped you keep engaged throughout the lesson. And it also made the learning so much more effective. Moreover, the same principle is actually applied more broadly within the chiropractic skills class. I love the fact that you're able to have a number of classes of the skills weekly rather than just learning the theory. You actually got to practice the techniques of chiropractic and then further develop your adjusting and manual skills while also understanding why and how you might use this in the future. This principle alone definitely explains the reputation Macquarie chiropractic graduates get. Because this degree has, classes daily, the relationships you develop with your colleagues is amazing. I vividly remember spending hours studying with my uni friends before classes and in between classes. And yes, sometimes they weren't the most productive study sessions, but this only meant you got to know your colleagues better, resulting in amazing friendships. And those friendships are still as strong today as they were back then. And to touch on the other two's point of view, the relationships you also build with tutors is amazing as well. The one-on-one times you have with them within class, the opportunities you have outside of class with, supervised pracs, you actually get to know them more on a personal level, not necessarily they're, your teacher and you're the student. So yeah, you almost build this kind of really friendly relationship where no matter what you're feeling, they just become very approachable. And I felt that really helped, just try to learn stuff and understand things while going through my degree. Once a tutor or a teacher is approachable, it makes life so much easier.
For sure, for sure. And lastly, Rachel, did you want to share some insight and personal experience with us from your Masters of Speech Pathology?
Yeah, I definitely would. So my name's Rachel. I'm also in the second year of my Masters, which is my final year. So I would describe the Speech Pathology Masters. It's been really brilliant. To sum it up, it's really comprehensive, but it is also a really intensive course. There's so much to cover within 2 years. Speech pathology is actually a really broad field, but the course is structured in a way that it does really support you as you build this knowledge and your clinical skills over time. So we also have placements, I think, from the 4th week of our first year, and then you have those placements all the way through. So that placement has actually been a real highlight for me in the course. So throughout my placements so far, I've been in hospitals, I've been in pediatric private clinics, I've been in the Macquarie clinic. I'm actually due to go out to Dubbo in a couple of weeks to a rehab hospital out there as well. So those placements are amazing. You get this clinical experience with a supervisor one-on-one, and for a little speechy nerd like me, I just thrive. They've been so brilliant to develop those clinical skills. The other highlight I'd bring up, similar to what some of the other people have said, is also my cohort. So we have 40 people in our course. That means it's the same 40 people in that classroom 2 days a week. And I found that really means that we've all got really close. We've been in a working group with about 8 people from our course from that very first week. And that means you've immediately got a support network. On those placements, you also often have a buddy, so you get to know them really well. You've got this network of people during the intensive, more hectic bits of the course to really support you through it. The other thing I'd say about it, similar to what everyone else has said, is our lecturers and our tutors, they're so passionate about what they do and they are so approachable. At times before assignments, we ask a lot of questions and they're always so patient and so willing to engage and chat with us. So overall, the experience of the Masters of Speech Path, it's been pretty amazing.
Perfect. Thank you for sharing that. So I'll throw back to Amanda now. Do you have any career aspirations moving forward, or is there anything that you'd like to let our future students listening today, give them any pieces of advice?
Yeah, I'm actually now, this course has made me really ready for work. Like, I'm really ready to get out there. I'm really looking forward to having a caseload. I'm not actually nervous about that now. I am nervous about interviews, but I'm just looking forward to, I'm feeling confident enough that I'll be able to get out there. I'll have enough knowledge, and yet because I've done placements in the workplaces, I know that I will also be supported when I'm a new graduate. So that's quite reassuring. I'm pretty sure I will do a PhD one day. It will be down the track, but yeah, I'm really motivated for that. And my advice, people will probably roll their eyes at this, but I've only just discovered OneNote. So definitely use OneNote or EndNote or whatever it is, get using. And also I've only just started using a reference manager, and I use Zotero, which I think is free. And I downloaded it and then I didn't use it for 6 months, and I've just started using it, and I wish I'd used it earlier. So if anyone is behind the game on that, like me, get cracking, download it, Zotero or something. And that's my advice.
Thank you very much. I will take that advice on board. But yeah, I was just going to say, I think Macquarie definitely sets us up for great success as a graduate. I also agree with you. The Doctor of Physiotherapy program will really, I think, launch us quite well into the workforce. And I guess something that I wanted to share is, if you're thinking about it, don't hesitate, please apply. It's a great experience. And I'm sure all of these panelists today would agree with me. So I was wondering, from Ben, is there any advice or anything you'd like to share for our students potentially going to study the Master of Public Health?
Yeah, definitely just dive right in and just, say yes to everything as they pop up. I've gone through so many different opportunities this year and last year alone. Like, I've done a pitching workshop. I'm doing the global leadership program now. Even outside of Macquarie, I did this mentoring program for 6 months, which was sick. And that's all just from word of mouth from my lecturers and things they post on the notice board. So definitely, if you see something that looks interesting, just jump on it and give it a crack. Definitely, yeah, that's what I'd say.
Beautiful. And for anyone listening out there, if you do have questions for any of our panelists, please keep popping them in the chat function below. So Cooper, do you have any career aspirations moving forward, or again, any advice for our listeners out there?
Yes, definitely. In terms of career aspirations, what I potentially want to do next year, the first year out, is go regional for a few years. One of the great benefits of this is the amount of experience you get compared to more metropolitan areas. The variety of people and the situations you're exposed to is just more varied in terms of the experiences you get compared to Sydney or more metropolitan-based areas. But it's great that the Masters of Chiropractic also gets you prepared with that. Within the last year, you have your placements, so you get placed at one of the clinics, either at Summerhill, Macquarie, or Eastwood. And by the end of the year, you need to have 300 consultations done. So you would have had to have not necessarily 300 different people, just 300 appointments by the end of the year. And I believe, once you hit your 300 mark, you're definitely ready to go out there. In my eyes, there's 3 things that really help you become a good chiropractor. First is experience. Getting your hands on as many bodies as possible is vital, as it helps build your confidence as quickly as possible. Secondly, you have to put the effort in. Everyone's heard of the saying, P's get degrees, which, yes, well, technically that may be true. In my eyes, you really do need to put in the effort and the time to understand the human body, how it works, how it reacts to things, and then the different external factors that might influence, your treatment. Without that motivation or effort, you're not going to be the best version of yourself, which to me is really important. And lastly, you got to enjoy what you're doing. If you don't have the drive or want to practice, then the ambivalence is going to be obvious to the patient. Once they see that, they may lose confidence in you, not follow your rehab suggestions, and probably won't return, which isn't a great outcome for either of you, further undermining your confidence. So my advice to any future students is prepare yourself for a bit of study. It's not a degree where you can just breeze through. Make sure you really do listen in anatomy classes, because trust me, it will really help in practice. Gain as much experience throughout the years of study. Go to as many chiros, see how they practice, go to seminars and information nights. There's groups on Facebook like the Muxa group and the Chiro Classifieds, which, there's regular posts, daily posts of information nights, seminars you can go to, and just try to absorb as much as you can. And lastly, have fun. You may only be at uni once in your life, so make it worth it. And as I said, I'm not going to lie, this degree will ask a lot from you, but in doing so, it also give you so much in return. The result is a more resilient, competent, and confident human being, characteristics that positively affect all areas of your life, while at the same time helping you build long-lasting friendships and relationships with the colleagues that you do go through the degree with. So yeah, just get yourself out there. As what's it called? As Ben said, just if something's interesting or something pops up, just go to it. One of the best advice I got when I started was from a colleague that was in his final years. Just whenever you see something, even if there's not much interest, just go to it. Because absorbing information from people that have had the experience of practice, being out there, seeing cases, seeing weird and wonderful cases, knowing what to do in that situation is just a lot. It takes the pressure off when you actually do get in a situation like that. So yeah, as I said, just get yourself out there and have fun while you do it. You only get to do stuff like this kind of once in your life, so make it worth it.
Absolutely. These are some wise words from our panelists. I'm loving it. Yeah, for me as well, my career aspirations at the moment, they change depending on what placements that I get exposed to. So currently now I'm leaning towards maybe private practice or sports physio, but I'm also definitely not disregarding the hospital side of physio as well. So Rachel, what are your career aspirations, and do you have any advice as well to share for the Master of Speech path?
Yeah, thanks, Kiara. I'm a little bit similar to you on the career aspirations front. So I came into this course really set on working with adults, and I have found working with adults really enjoyable. People after a stroke or after a traumatic brain injury and other conditions, of course, helping them with their speech or their swallowing. It's really rewarding. It's really meaningful work. But on the other hand, I'm currently on a brilliant pediatric placement and I am loving working with the kids. It's so much fun. Like, I didn't know doing speech pathology could be so much fun, but I found that really engaging and I really enjoy that as well. So at the moment, I have no idea what aspect of speech pathology I'm going to end up in. I keep on finding out about more little niches and I'm like, oh, that one's really interesting. But so who knows where I will end up. Yeah, but I think that's kind of a strength of our field, that we can work in so many diverse areas at different points in our career. Yeah, similar to Amanda, potentially a way down the track, I would consider doing a PhD if there was an area of clinical practice that I wanted to know more, but I'm not sure about that yet. In terms of advice, I have two key things that I wanted to say. Firstly, the master's program, it's a marathon, not a sprint. So it is quite an intensive course, as well as being an amazing course, but that does really mean that you need to have balance, you need to have a good support network, and you need to look after yourself. Otherwise, you're not going to get through the course. It is amazing, but you do really need to, like lots of people have been saying, it is a master's program. It will require a lot as well. The other thing I'd say is find out more about the profession. So I would really recommend having a look into speech pathology podcasts. There's lots of great ones. Also speech pathology Instagram, apparently speech pathology TikTok, but I haven't gone down that rabbit hole yet. Also have a think about, do you want to volunteer or work in the sector? Just really expose yourself to as much as you can. Yeah, both before and during the masters, if you can fit it in. I feel like, as well as sort of nourishing your passion for the field, it will help you figure out what a speech pathologist actually does day to day. Yeah, which is really good insight. And I know I'm still doing those things and learning new things. Finally, I just say, look, if you're interested, I could not recommend the program enough. And particularly I found the Macquarie program has been really brilliant. So go for it.
Absolutely. Yeah, I think Macquarie offers such an amazing variety of postgrad degrees, especially in our faculty, and the ethos that Cath touched on earlier, the heal, learn, discover, it definitely applies across everyone's postgrad degrees here. So couldn't recommend this more. But now we'll start turning towards our live Q&A. So if anyone has any questions, we've had a couple come through already, but keep sending them through. So I'm going to ask Amanda, what are your placements like, and what's like sort of the process, and are there placements all the time throughout the degree, or do they come in the last few years? What's the vibe?
So if the year is divided into the 2 semesters, you will have it's sort of like a block of a few weeks where you have your placements. Some people will have a placement at the one place for like, say, a week or 2 weeks, and then other people will have a block at several different places that kind of adds up to the 2 weeks, if that means, but everyone's doing it at the same time. There's usually like a few weeks allocated to clinic placements. And then you might go to, so there's the audiology clinic that's on site in the Macquarie University with some really excellent clinical educators. So you might go there, or you can go to hospitals like Liverpool Hospital or Sydney Children's Hospital, or you'll go out to some of the, like to Hearing Australia, for example, which is like some of the outpatient audiology programs. When I went to the Northern Territory for the research placement, that counted as one of my clinical placements. So that was a 2-week block straight up. So yeah, that's how it happens. And then they're also smattered in between the semesters, like in holidays, for example, there are additional volunteer opportunities that you can count towards your placement as well. So I think everyone just likes to try and get some variety in their placements, and the lecturers who are organising the placements and offering the opportunities, that's what they're always thinking of. So that's what they're sort of trying to give you. What you had a second question, I can't remember what it was.
Yeah, I was just wondering as well, so you mentioned the lecturers source the placements for you. Do you preference them at all?
Oh, so I know like a few of my friends in the course, when they've been particularly interested in a place, have gone to the lecturers and say, I'm really interested in that. And in those particular cases, the lecturers were able to make that happen. Yeah. So if you've got like a burning desire, dream, I mean, still the lecturers are trying to balance the availabilities, but yeah.
Perfect. Thank you very much for answering that. And we have another question for audiology as well. There's a high competitive entry requirement. So what do you recommend you can do to make yourself stand out amongst the other applicants?
Yeah. Obviously they want to know that you're passionate about it, obviously. And if you have done any sort of work experience in an audiology clinic, then that's very helpful. But I would say that the other thing is, I mean, like all the other master's courses, it's intense and it's heavy going, and they want to know that you are capable and self-motivated. So I would say if you're the sort of person that volunteers for a lot of things, it doesn't have to be audiology, but you get out there and you get part of initiatives, and then you can write that in your your personal statement. I think that shows that you go above and beyond just doing what you have to do to get by. And also Hearing Matters Australia, their offices are in Macquarie. They actually run a hearing aid bank program. They run lots of things, but one of the things they run is a hearing aid bank program, for example, where they get reconditioned hearing aids, and they're able to provide them to low-income earners who don't get any of the other government funding and really need a hearing aid and can't afford it. They're a great organisation, and I know they're always looking for volunteers. So I would also suggest getting on their website maybe and seeing if you can volunteer with them. I mean, that's very audiology. It doesn't have to be an audiology volunteering thing, but that's an example.
Perfect. All right. So we've got a question that I think everyone here should be able to share their advice on. So the question is asking about getting case studies throughout the degree and doing some problem solving, because, as we graduate, we're going to be dealing with problems for the rest of our lives. So for the Doctor of Physiotherapy program, yes, all of our tutorials, our exams are all problem-based learning. So we'll get case scenarios, and then we'll answer some questions. We'll discuss them in the tutorials. Our exams are all case-based as well. So I've got a couple coming up soon. And yeah, the uni will release case scenarios, and then we'll prepare them, and then they'll ask them in a Viva style question. So yeah, it's a great opportunity to it goes beyond rote learning the content, and you more have to apply it into the real life scenarios. And it's great because all of our lecturers and tutors are all still practicing in their daily lives. So they're bringing in their real life case studies to class as well, not just the ones that have been prescribed already. And they're saying, you know, hey, I saw this yesterday. What do you guys think? And then we'll sit around and discuss. And something cool that Cath touched on earlier was our case study rooms that are available in one of our buildings, and they're modeled off the Harvard Medical School style structure, where they're in like a semicircle shape, and it makes it a perfect environment to discuss these and really get connected with our classmates. So yeah, what about you guys in Chiro? Do you guys discuss some case studies like that?
Yeah, 100%. Pretty much near exactly what you said, to be honest. Yeah, most of our exams are based off cases, as the same as you. I've got the big Viva exam at the end of the year, which is based off a real life case as well. But in terms to continue with the question, in terms of complex problems, that's definitely something that they do well with. It's not necessarily just simple musculoskeletal cases where they've just injured the shoulder, or it's a muscle, it's a bone. There's a lot of cases, like there's a unit called diagnosis and management, and that's done weekly as a two-hour tutorial. In regards to that, you go through about 2 to 3 cases per actual lesson, and at least one of those cases will have something tricky in it, in terms of something that's not necessarily related to the musculoskeletal system, potential cancers that can mimic musculoskeletal pain, infection, the more serious comorbidities that actually could affect the way you treat. So they definitely kind of prepare you for all different experiences or presentations that could present to you. And in saying that, it's actually really good to have that, because you don't just get comfortable with the stuff that you do know. You kind of are forced to learn all the the secondary stuff that you might not have anticipated you would know in the future. But knowing that, it's just going to prepare you even more for the future and make you a better practitioner next year.
Perfect. What about speech path? What do you guys study there?
Yeah, so it is pretty similar. Quite a lot of our assignments are based on case studies, and also it's covered quite a lot in our classes as well. The other thing I'd say is similar to what Cooper was saying, it's complicated cases. So we'll get a case study. Quite often the case study information is like a full A4 page, and you're just like working through trying to figure it out. We'll get things like you're trying to figure out, does this child have a language impairment, or is it just because they're bilingual, and just trying to like tease those things apart. So the real life complexities that actually you would be dealing with as a speech pathologist, they're really, working through those. And I guess more with like the adult and the medical side of speech pathology. I know it's not medicine, but like the medically side. Just similarly, all these different medical conditions and how that could impact on speech and swallowing. So you really have to think it through and apply it yourself. So yeah, very similar, lots of case-based.
Beautiful. So I hope that answers your question there. Another question we've got is regarding study and then working at the same time. So for me personally, I actually work at MQ Health in hand therapy there. So I'm actually able to study alongside work, which is really great. Means I can still get a little bit of an income. So I was wondering, maybe Ben, if you've got a job alongside study, if you wanted to share how you manage the study life work balance.
Yeah, it's it's definitely been it gets crazy at times. Like I've got 3 jobs at the moment in addition to my studying, and I'm studying full time, so I don't know how. I just do it. So I'm working as a barista at a cafe. I'm also working as a youth worker at Willoughby Council, and I do like an afternoon after school care for like young kids, 5 to 12 for primary school kids. But yeah, I guess I want to say like organizing is key, but I'm a terrible organizer. A lot of it is just starting things early and then kind of using that nervous energy throughout your shift to kind of come home and then just write it out and just get something down. I think, working and studying is a challenge, and it's really hard, especially if you're in worse situations than me. Definitely look at scholarships. I mean, I'm also lucky enough to be getting a scholarship, so I don't have to, you know, work a lot. I'm just kind of getting a little bit of money from Macquarie for the research that I'm doing. Plus I've got to, you know, also get a bit more to top up to pay rent and food and things like that. So definitely look into the scholarships and what other helps out there. If you're an Australian citizen, I know there's a lot of government subsidies if you're studying, which may help bring down your workload so you can focus on the studying. Yeah.
Perfect. Thank you very much. So yeah, I hope that answers your question. There is definitely a possibility of studying alongside keeping a job. So there's definitely hope out there. So Amanda, we've got a question that's come through wanting to know about your journey leading up to your decision to pursue audiology. And is there anything unexpected that you've come across in your study?
Unexpected. It was a little bit harder than I thought it was going to be. Manageable, right? But it was a bit harder. So my journey, I'm a mature age student. My undergraduate degree was 20 years ago. I went to Sydney Uni and I did speech pathology. And I worked in it for like 5 years in adults, in neuro and traumatic brain injury. And then I went overseas. Anyway, I had children and I had a big break. And when I came back, I just really wanted to do audiology. My mum is half deaf, so I think it was just always in the back of my my brain. And Macquarie Uni was definitely the course that would get me there, because I could use my undergraduate degree and then do the Masters of Audiology and get through. So I thought that there would be a lot more overlap between speech pathology and audiology, and there is overlap. But if I thought I was going to breeze through audiology because I had a speech pathology degree, I was seriously no. It's been heavy going, but I do not regret it at all. I love it. I just feel like I'm so glad that I did it, and I can't wait now to get out in there, having a caseload, get back into work, and as an audiologist.
For sure. Now, a lot of questions are coming through in regards to all of our applications for our relevant degrees. So I'm not sure how each of yours works, but people are asking, how do they stand out? What sort of things should they be putting on their personal statement? Things like that. So I'll speak on behalf of the physio program. Putting yourself out there in the best foot forward, I would say work really hard, because as we all know, these degrees are quite competitive to get in. So aim high with your marks, because you don't know how competitive the cohort will be when you guys apply. Make sure that you gather all of your information when applying for when you put down all the prerequisites that you've done. Make sure that if you have done study, get all of the study guides or course guides that you have that detail the things that you've learned in each of the units that are required for the application, because it's a lot of paperwork and it takes a lot of time. So if you can start gathering that now, I think that's a really good position to be in as well. And just make sure that you tick off all of the requirements as well. And if it means extra study, just ensuring that you don't apply and then forget that you need to have done this prerequisite. So I'm not sure what life is like when you're applying for speech path. Maybe how should our future students sort of put themselves out there and stand out in their application?
Yeah, so I think there are some parallels between speech and physio. So I would agree that your marks do matter. But the other thing I would say is, look, obviously I was not on the application panel, so I'm just saying what I think. I feel like the approach to selecting students was really holistic. So there obviously is a limited cohort. It is obviously competitive to get in, but it is a combination of your marks and your personal statement. So look, obviously if you can get some experience, that's great, but it is not required. And also just I feel like they're looking at your passion. What do you know about the field? If you've got an unrealistic impression of what being a speech pathologist is or what we actually do, like if you think speech pathology is just lisps, yes, we do that, but we do a lot more. So making sure you understand what the course is broadly, putting that in your personal statement. Yeah, they do look at it holistically. So do think about the whole picture, your marks, but also your knowledge of the field and your passion and your experience, I feel all tie together in your application.
Definitely. And what was the application like for public health, Ben?
Oh, I'm thinking back now. I'm pretty sure, I don't know, I can't remember if we had to write a personal statement for public health. Don't quote me on this. But I definitely had to write a resume of all my work experience and how that kind of relates to the public health field. So definitely get your resume in order. If you have any referees who can give you a personal reference or a character reference, that would definitely help in your application. Any kind of certificates or things you've got, just add them all into your application. Like the more the merrier. And I guess, yeah, just show them that you're enthusiastic about public health. Yeah, I mean, as I said, it was the middle of lockdown. My notion of public health was COVID, and I was like, well, it's kind of interesting. You know, I was doing psychology, and I was like, I'd love to kind of see psychology more of like a global scale, because I'm seeing, like, you know, particularly in my hometown, depression among young people is quite prevalent in when I was growing up. So I was like, I really kind of want to do something about that, but I don't think one-on-one psychology is what I want to be doing. And I guess my kind of experience and what I kind of chose to put in my resume and my kind of life work choices, I guess matched up to what they were looking for. So I guess kind of tailoring your resume to the field that you're going into, public health, I think would be a great start.
For sure. So it seems like there's some common themes. Was it similar for you, Cooper, in the chiropractic application as well, just to get as much experience and hands-on stuff?
Yeah, pretty much all the other guys have pretty much said what I was going to say, just in reference to chiropractic. Yeah, just have a good looking resume in terms of the field that you're going into. So, you know, have stuff there that has to do with, you know, either chiro, anatomy, you know, exercise physiology, just stuff that is similar to what you'd be going into. Definitely put, you know, as I said before, try to go to as many information nights and seminars as possible, so you can then say, you know, what your interests are on your resume are, you know, blah, seminar this, information like this. So at least it gives the, you know, the people reading the application a sense of, oh no, this guy's going out of his way, wanting to research, wanting to understand from his own motivation, not getting forced or getting, you know, taught to. And that kind of shows a, you know, good sense of, and not necessarily aspiration, but a good sense of drive from yourself. And people like that are choosing students to actually go into the masters are looking for that, people that have the drive and the motivation outside of being, you know, forced or told what to do. Just being a little bit independent and having a good looking resume, making sure that, you know, it's nicely formatted, it's simple to read, it's not, you know, too much of this everywhere, but nice and simple, have stuff that is relevant to what you're going into, and yeah, just go out of your way and go to all those information nights, and then I really appreciate that 100%.
Perfect. Well, I think that brings us to the end of this session. Thank you everyone for sharing your insights. I hope that you guys have taken away something, in, especially with your applications. Please don't hesitate to apply. You might surprise yourself, but yeah, I think there's some definite common themes of getting involved early on and looking at your resume. And also it's the smaller things as well, which will make for a big difference later on. Thank you very much, everyone, again, for your questions. Sorry we didn't get to everyone's, but if you do have any burning questions or you'd like to chat with Macquarie, we are offering our one-on-one consultations. You can also chat to our postgraduate team, who will be available to answer any more specific nitty-gritty details about the degrees. I think we've got a QR code coming up on the screen. So if you guys want to scan this will take you to our postgraduate courses, our consult, who will help you with your questions. So thank you very much once again for our panelists. We are now going to move into our last session, which is looking at the postgrad psychology from a student perspective. Thank you, everyone, once again.
Thank you.
Thank
See you
you.
later. All right. So if you've just joined us, hello and welcome again to our last session for the Macquarie University Postgraduate webinar on the Medicine and Health Science faculty. We are now in our last session on the postgrad psychology degrees. So I have invited some current students as well as some of our alumni from these degrees who are going to share their personal study journey and some experiences. So again, if you guys have any insight for our students and our alumni, please pop it in the chat below and we'll open up the session for a Q&A eventually. So to welcome you guys to our webinar, please welcome Matthew Warner from Clinical Neuropsychology. Thank you. We've got Isabel Sands who's studying who did study clinical psychology. Welcome, Isabel. We've got Gabriella Gustafson from Organisational Psychology and Joanna McCarthy, who is an alumni from Professional Psychology. Welcome, everybody. So I've got some questions for you all. First of all, to our current students, Gabriella and Matthew, I was just wondering why or what made you guys want to study psych at Macquarie, and sort of what has been the highlights of your studies so far.
I guess I'll jump in. With organizational psychology, Macquarie is the #1 and only university in New South Wales that offers the Masters of Organizational Psychology program. But even with that, I did apply to the whole country. There are 5 programs, and Macquarie just outshone the rest in the employability after you leave and after experiencing it. Yes, I am a current student, but I did just submit all of my final paperwork today. So I can say kind of on the completed note, the experience with the faculty, absolutely incredible. And thank you for the applause, Cath. But I was lucky enough to be the student rep during my 2 years, well, I guess 2 and a bit now, in the master's program. And I brought student concerns, student compliments, student complaints to the faculty. And not only did they listen wholeheartedly, but they would act upon absolutely everything, and things that could not be changed or were out of the power, they were so transparent with and talked to us as the student body to see what they could do to make the experience better. And I have never had that in any other school experience in my life. And this is my 5th degree.
That's really amazing. Well done, and congratulations for submitting. And to Matthew, why did you sort of decide to study psych at Macquarie, and what has been some highlights of your study so far?
Yeah, so I did my undergrad at Macquarie as well, in psychology, and my honours here as well, which is really good program, felt like a really good base that was built there. And then, yeah, there's good diversity in subjects, which help you, give you good opportunities or to branch out and explore other areas of interest, which I thought was quite cool. And then in terms of postgrad here, there's only really 2 courses in Australia that offer neuropsych masters without needing bridging or PhDs, like combined degrees. So it's kind of between Macquarie and Melbourne in the sense, having grown up in Sydney, it's much easier to be here local, but having said that, the program's been really good. And I did want to stay at Macquarie following my undergrad because it seemed like a great program. The staff throughout undergrad and postgrad have been really good, really accessible. And I think that's something you really come to value, especially moving into postgrad. Because, yeah, it's obviously a lot more hands-on. You're starting to think a lot more about the future with what you're studying and where you want to go with everything. So having staff that are really accessible and experienced in these areas is really helpful. And I think also as well, that small cohort, I know people were talking about it before, but that small cohort does make a big difference, especially compared to undergrad psych, which has got heaps of people. But it's very different being in a cohort with all of just over 20. You come quite close and you can really benefit from that. Yeah, being able to learn with each other and bounce off and help when needed. It's been really good experience so far.
Amazing. And for Gabriella, what are your plans moving forward once you graduate? And do you have any advice for our future students who are thinking about studying these programs?
Well, thinking back to before I did the Masters of Org Psych, given the way that the system is in Australia, it is very much geared towards we need clin psychs, and we do. We need so many clin psychs. You can see in those wait lists. But organizational psychology is something that's not really spoken about in undergrad. And I'm really passionate about sharing it because it is about preventative mental health, that we can go into workplaces, we can go into organizations, we can go into teams, we can go into sporting organizations. We have such a wide reach where we can start to help people understand how to work together, how to behave in teams, how to watch out for their well-being, for others' well-being, how to reduce stress, anxiety, workload, all those things that come along. And maybe through that, we can prevent some of the cases of people that need to go see clin psychs and open that space up, reduce those waiting list times so that the clin psychs that we have less of a waiting list and we have less people needing to go in. And with org psych, that's just something that's not spoken about. And it's such a wonderful thing and a wonderful impact that we can have. And so if you're on the fence about what psychology you want to do, I mean, we do have many different endorsements. Really have a good look at org psych and the things that we do, because there's just so many avenues that you can go down. I know myself, I went into org psych thinking I wanted to do leadership and thought, oh, great, this program is going to help me really narrow down what I want to do. No, I could not be more wrong. It expanded my horizons. And now I have a lot of opportunities. When they say 100% employability after the org psych program, it's so true, because the interviews and the possibilities that are out there, anything from user experience and human factors to HR generalist, to consultancy, to well-being, especially with the new psychosocial hazard mitigation that has come about in our OH&S standards. There's so much to be done in this space, and this space is enormous. So I can't really tell you what I'm going to be doing because there's many pots on the stove right now, but it's a really exciting time to be in org psych. It's the fastest growing field of psychology in the world, and it's just been declared a STEM field in America, and hopefully the rest of the world will follow suit. So again, dive in. I know it's not talked about much in undergrad, so please have a look, go on the APS website and see what we do.
Amazing. That sounds so cool. Thanks for sharing that. And Matthew, what are your career aspirations moving forward once you graduate? And yeah, if you have any advice, please share it.
I think I'm in a similar boat at this time point where I'm not 100% sure where I want to go. I think that's okay as well, being second year, finishing at the end of this year, maybe early next year. But I think the placements that are provided and offered are a really good opportunity to work with different populations, find your feet, see what areas you might enjoy working in more than others. And so that's something that I'm really looking forward to continue all my placements and just get that exposure and see where I might want to move into. I think at the moment, I'd like to work in public health in some manner, maybe some sort of rehab services. Haven't had any exposure really there, but just from my experience so far, I think that'd be a really interesting area and something that'd be cool to work in moving forward. But we'll see what happens, I suppose. And then in the sense of advice for future students is, I think this is more general, but I think it's really important to make sure you follow a path that you do really enjoy and are passionate about. None of these programs are, I can't really speak for the others, but I'm sure they're very busy. It's a full-on couple of years. But for me, it's been really good nonetheless, because I've really enjoyed what I've been learning. And I think that's really helped me get through without heaps of issues. I think that's a really important thing. So I know it's kind of cliche, but it's really important that you're doing something you want to do and you're interested and will enjoy down the road. I think just make sure you are passionate about whatever area you want to go into, yeah, not think too much about other factors at that point, because yeah, there's opportunities in all these fields moving forward. Yeah, and it's just about where you think you'll really enjoy working.
For sure, for sure. And moving forward for Isabel and Joanna, who are both our alumni. So you guys have obviously completed your coursework at Macquarie and all your practical training. Do you guys have any experience that you'd like to share in both of these aspects, maybe about your degree and what are the placements or the practical classes like, anything like that you wanted to share? Maybe start with Isabel.
So in terms of commenting on both aspects, I feel like I can comment less on the coursework just because I know there's so many changes in place. But I think those changes reflect, similar to what Gabriella was talking about, the faculty are really warm and really engaged, and really like the changes that they're making are part of the process of making the degree as rewarding as possible and as manageable as possible, which is really wonderful. From the placement experience, I had really great experiences across the board. So both of my external placements were through public health, in the forensic hospital, which is working with people who've done acts of crimes but are not guilty by mental illness, and a place called Coral Tree Family Service, which is a residential family-based service for where families come for 1 week stays, and it's like working with the whole family with when they're presenting, often with children with difficulties with aggression. So amazing experiences through both of those set me up really well to now be working in public health, and like had access to really good supervision. The internal placement's really great. That spans for 12 months. You get to work across the age range. So in my personal experience, I worked from 4 years old to my oldest client was like in 70s. You get chance to get experience with intake and with psychometric testing. You get a chance to chat with neuros as well and learn a bit from them. But not the same extent of testing, obviously, but if you can grab one and ask questions, it's good. And then there's opportunities for peer supervision and for sort of informal debrief with people. And I guess the best thing also would be the cohort. We all go on weekends away every year. It's really nice. Yeah.
So good. That's so nice. It seems like it's a really good supportive degree. So for Joanna, what has sort of been your experience in Macquarie, studying at Macquarie, and the coursework and all the pracs and stuff like that? Did you want to share your experience?
Yeah, so I guess, so I did Master of Professional Psych, which is a 1-year master's program, and it works so you do 1 year coursework and 1 placement. And I did my undergrad and honours at Macquarie as well, so that's been sort of quite an easy transition. The coursework is like quite practical. Like we do a lot of case reports, we learn a lot about assessments and a lot of counselling skills and sort of stuff that you need to be able to go straight into the workplace, rather than essays and literature reviews and that kind of more heavy content stuff that you do a lot in undergrad and honours. We don't have a thesis as well, which was a little bit of a bonus because I came straight from honours. And yeah, overall, I really, really, really was so happy to stay at Macquarie. I applied for quite a lot of places and I was just so relieved to stay with Macquarie. Everyone on the course is just so warm and supportive, and they really have like their best interests, like your best interests at heart through the whole course. I went on a practical placement at a private hospital that did a lot of alcohol and drug and mood disorders, which was really cool because it was actually somewhere I'd really wanted to sort of like try out and explore in general. And so you kind of got a little bit of choice with where you got to go. So that was really nice because I know some places don't always give you so much choice. It was a really, really rewarding experience. I'm not currently working there anymore. I'm in a private practice instead, but I would definitely go back. The whole time you're very well supported and like you feel not you feel ready when you start at placement. Like it's a little bit scary at first, but you realize that you've actually learned everything that you need to get through it. Yeah, I don't know. Overall, it was just a really practical course. And I feel like now doing my internship year, because it's part of the 5+1 program, if you are aware of that, I feel like I don't have too much imposter syndrome, and I'm like well equipped, if that makes sense.
Perfect. So I guess you guys have already kind of touched on this, but if you wanted to sort of share maybe what a day in the life looks like for you guys and give an example of sort of how Macquarie's really set you up for it. I'm not sure if you guys mentioned if you're a provisional psych or a psych, but if you wanted to just refresh that. And yeah, what do you guys think that Macquarie's done to sort of help you and set you up for that? Do you want to start, Isabel?
Sure. So I'm registered as a psychologist, or I could go by being a clinical psychology registrar. So the way it works is you do your 2-year Clin Masters, and then you've got a 2-year registrar program, and then I'll be a clinical psychologist. Day in the life, trying to think what I did today. So I'm working in a child and youth mental health service. So that's a so it's a specialized family-based community mental health service for families and young children and young people presenting with moderate to severe mental health difficulties. So on the higher end of sort of acuity and complexity in the community. So like a step down below admission. Day in life, because I'm doing children and young people, it's therapy, but it's really important that it has, I guess, like a case management flavor as well. So it's really important to be working in a team with school, working with daycare, working with any other professions that are involved. So sometimes that involves taking on like convening case conferences and so working with the young people and with parents in a joint way and sometimes in a parallel way as well. The ways that Macquarie set me up for it, I think firstly in like the stance. So I think Macquarie did a great job of just, I guess, like support around like you don't know what you don't know. Starting this degree is a big learning curve. Finishing this degree and starting working is an even bigger learning curve. It's really lifelong learning and reflection, which I think is so great. Yeah, so I think that's one way that Macquarie set up, but also in the training aspect. So building skills in evidence-based formulation, understanding the literature, you get a really good intro to CBT, cognitive behavioral therapy, but you also get signposted to other therapies. And I think they do a good job of moving towards sort of process-based formulation and intervening at, they do a good job of adopting a critical lens within the view of clinical psychology, which, you know, it's different to other professions, like social work and OT, for example, have equally valid views on things, but within the clinical psychology, I'm rambling a little bit, so I'll let you speak, Johanna, but Macquarie prepared me really well. I haven't gone into something that I've gone into family therapy. That's not covered in the degree. That's a separate degree. But Macquarie still gave me the skills. Yeah.
Yeah, so going off that, so I'm now a provisional psych. So I'm doing the 5+1 program, which means 5 years study and then 1 year internship, which is when you're a provisional psych. I'm currently not working I'm working 4 days a week, not 5 days a week. So it's probably take me a bit longer. But that's quite typical. Not many people finish in the year. So, but that's because we also have to do an exam. So I'm kind of my day in the life. So I'm working in a private practice. Currently, I'm predominantly working with adolescents, which was sort of just happened, and now I'm kind of really enjoying it. So it's kind of worked out well. But we do see all ages, and I will expand to see people of different ages as my training continues. I'm really lucky to have found a private practice that provides a lot of internal supervision, which is not always the case because you have to have supervision requirements and sometimes you need to get external supervisors. So I'll get supervision a couple of times a week. I see a caseload of about 4 clients 3 days a week. And then that will increase. But yeah, and then there's like, I do a little bit of study and professional development around the exam and also just expanding my skills, because although I'm working like mainly full time, it's kind of like you're still learning and you're still doing that ongoing training, but it's sort of more in the context of seeing clients. You don't need to be doing private practice like I am though. Like I have lots of friends who are doing very different things. Some are in more sort of like working for Headspace or doing more multidisciplinary work, or lots of people in the prison systems and things like that, in hospitals. So it's really broad once you get out there. Macquarie has gotten me ready for it. I think they were really good. I think it's similar to the clinical program. There's a big emphasis on like formulation and sort of process around that rather than like being more rigid in their approach. It's very much like they want you to have a holistic view of, I don't know, psychology, and they sort of give you just the really basic skills, but then encourage you to be critical and like ever improving and that kind of stuff. I will say we got a really big emphasis on just our counseling skills in general, like just how you talk to people and that kind of process that you have in talking to people. And that was really good because it's quite nerve-wracking going into that after having such a non-talkative degree. Like the undergraduate is quite isolating at times and you're doing a lot of writing and reading. So to make that jump to actually talking to people and making it more practical, the master's program did that really well, because to bridge that gap was quite an achievement really, and they did it really well in such a short period of time.
Amazing. Thank you for sharing. So now we're going to move into our live Q&A. So we've got some questions that are flooding in at the moment, which is really great. So yeah, if you guys have any questions, please keep popping them in the chat function below and we'll do our best to answer them. So I'm going to kick off with Matthew. Have you found the career options for clinical neuropsychology are more limited than a general master's of psychology?
I'm not sure about more limited. I think it's a very different area of psychology. Again, we work across the lifespan. So yeah, you'll see any range of people, kids, all the way up to quite elderly people. And again, you can see them across public and private health sectors. So a lot of hospitals at the moment, generally it's probably some of the more major hospitals, have neuropsych teams that work in different departments, doing different sorts of things. And then private practices also do a lot of work with like assessments, especially like neurodevelopmental disorders. So a lot of private clinics will offer those kind of services. I know clinical psychology also does a lot of that as well, but there is that overlap there. So there's definitely plenty of jobs out there, especially considering there's not as many perhaps courses going around that offer neuropsychology. So in that sense, there's probably also a smaller, group of neuropsychologists out there going for the jobs. So yeah, I've also wondered, but I imagine if you move out of Sydney or Melbourne, which is where the two programs are, there's still going to be the same need for those services there. And without those, bases with the courses being offered there, there's definitely demand around.
Yeah, fair enough. Thank you for that question. The second question that we have for you as well, in terms of applications and applying for the clinical neuropsychology, do you have any advice on what type of work experience helps you or might help you stand out when applying?
Yeah, I feel like a lot of different stuff will be helpful. It's also, I suppose, what you learn from it and how you can relate it to what you want to do. I, for instance, worked in a psychology clinic, so not neuropsychology, but a psychology clinic. I'm still there. I only work 1 day a week now while I'm studying, but I was there for a while, and I've just been doing reception and admin work. But I've been there for a couple of years, and it's been really good. I found that really good and continue to do so. Being able to interact with these very experienced psychologists who know a lot about what they're doing, I found that to be a great way to get some sort of exposure to the world of psychology while I was still studying. I know a lot of people. I also helped out with some research for a little bit in my honours, and I know a lot of people do work as research assistants, interning in various places. I think there's plenty of opportunities around to help out with research, or people held jobs for a while in various aspects of the brain. But I feel like there's a lot of different ways you can go working in the field. And then it's about showing that passion, I suppose, that really helps you stand out in my head. Showing that you genuinely do want to be there and help people. And this is something that you want to be doing. And then being able to link that as well to what you've done so far. People also volunteer at various like Lifeline, those kind of cool centres as well. It's another really good way of getting exposure and being able to share some of your experiences, I suppose.
Perfect. Thank you for sharing that. And just off the back of that, people are asking about clinical psychology and their applications. So I was wondering, Isabel, if you have any insight onto that, if you'd like to share how to stand out and sort of maximize your chance of success.
So what it involves is, for Macquarie, it was like a series of questions that you answered in written form, and I think you gave your CV as well. And then there was a round of interviews. In terms of how to stand out, like that's a hard question to answer. I guess it would be, I would guess, being really reflective, sort of, I guess, knowing a little bit of like what the flavor of clinical psychology is, and being able to match that a little bit in terms of, I mean, it's the same as any other psychology, but in terms of emphasis on evidence, in terms of emphasis on evidence-based practice is really the tagline. In terms of work experience, it's pretty similar. So it's a real range of what people have done when they come into the degree. Some people have already done PhDs. Some people are already professional psychologists and are doing the Clin Masters. And then there's some people with really no clinical experience. So like what some people had done was Lifeline, ABA, applied behavioral therapy, psychosocial support work, working admin in practices, research jobs. Some of it, I'm sure, has got to just be luck. But I think like really reflecting on your stance, I'm really reflecting on why you want to be a clinical psychologist, and probably knowing that everybody's answer is to help people. So thinking, why do you want to be a clinical psychologist beyond that? Yeah.
Fair enough. And similar question for Gabriella. Any tips for the interview or application process for Org Psych?
Well, a lot of, I think, our psych entries are going to be a similar set of advice of, going out, trying to get experience where you can, which I know is difficult when you're balancing a full-time study load. But I really agree with everything that Isabel said about going out and getting that experience, and then knowing why you want to do this degree. I think that probably goes for all the psych degrees, but with Org Psych, I honestly thought that there was no way I was getting into it. just because I come with international degrees, and I know that it's really quite hard to get into university over here with international degrees, but I had a really clear purpose. I had a really clear experience during COVID with where I was working with clients, and I saw what could happen in a toxic workplace and the damage that it could cause. And I recounted that story and said, this is the moment that I knew, this is the impact that I know I can have, and the need that is out there is real. And I think that spoke absolute volumes, was I had a really clear purpose, maybe not a direction, because like I said, there's way too much stuff out there for me to choose, but definitely a clear purpose of why this was important to me. And I think that is really what helped me stand out from the crowd. There are only, I think the year I was in, our cohort's 25. I think they've upped it to 30 now, but I don't quote me on that. So it is small. So you want to make sure that you're very clear on that, and you're clear on how you're going to express that. I do suggest, and this is the org psych in me coming out, but to go look up behavioral interviewing questions and look up ABC answers or STAR. Both of those will definitely help you answer behavioral interview questions. But just to know what that purpose is that you have, and that's going to really help you stand heads and shoulders above people who are like, oh, I want to help people, because that's great, but why? They want to know why.
Thanks for sharing that. So we've got another question for Joanna. Is your internship paid, and do you fund your CPD?
Yeah, so I'm paid like quite well. I'm happy with how I'm being paid, and they offer everyone I know from my cohort is in a paid internship. They don't really have unpaid internships anymore. And like we were told by everyone, don't accept unpaid internships. So that's good. I didn't see any unpaid ones floating around like Sydney when I was looking for jobs before I got this one. And CPD, my clinic does have some like they organize some because they have a lot of registrars and other provisionals as well. But I will, if there's something I really want to do, like, you know, sometimes they have like a 3-day acceptance and commitment therapy course or something. I really want to do that, I'll pay for that myself. But there's a lot of free CPD out there. There's a lot of cheaper stuff, and a lot of practices do give you allowances. So something to look for when you look for jobs.
Perfect. Thank you for sharing.
Could I jump in just really, really quickly? So sorry. Just on the topic of placements, I'm blown away that professional psych has paid placements. That's so awesome. I just don't want anyone to go in blind. If you're going into org psych, most of our placements are unpaid placements that you usually do while you're doing the coursework, though you can do it afterwards. I just finished mine afterwards. But don't expect paid placements in org psych. They are out there, but they're few and far between. Other than that, I'm selling org psych to the hilt, but don't expect that for organizational psychology.
Just also to jump in there is because my internship is after the master's. So the thing with professional psych is I've finished the master's, I graduated recently, and then it's basically like going into the workplace. It's just there's stuff you have to do with ARPA and that kind of thing. So our internal placement wasn't paid.
Perfect. So question for our alumni, Isabel and Joanna. What is the difference between your degrees, clin psych and professional psych? Someone has asked that. So if one of you wanted to give it a go.
You can give it a go, but it's a tricky thing because neither of us have done the other degree. Yeah. So in terms of content, one's 2 years, one's 1 year. We do a thesis, and you don't professional psychology, and the placements look a little bit different. In terms of the actual substantive difference, once you're working, people will have different views on that. I would say it's mostly like a political difference. There's not much difference.
Yeah, I would agree with that. Like I currently work with people who have done the clinical program, and we sort of all agree on that. It's just kind of like the length, and then if you get in or not, or if you want to do a thesis, and yeah, but we're kind of doing same things, but not one or the other. But yeah, I would agree.
I guess maybe the only thing to add is like in the lens of it being a political difference, there are some differences to access. So in terms of rebates are higher for clinical psychology, and there are some roles that are graded for clinical psychologists. So, but there's a bridging course coming out. So for people that have done professional psychology and want to go into clinical psychology, bridging courses are coming out that are 1 year. So at the moment, what you have to do the whole 2 years again. So that's changing, but yeah, it's probably a pretty well, I don't know if it's contested, but people have different opinions about how much of a difference there is. Yeah.
Perfect. So I hope that sort of explains the difference between the two degrees. Someone has also asked what the interview and selection process is like for Clin Psych. Isabel, you think back?
Well, it's not fair to talk about the interview process in detail, so I won't. I guess, yeah.
Fair enough.
So I can't think of many. Yeah, it's just an interview. They're very warm.
That's great. So I hope that answers a little bit of your question out there. So someone else has also asked in neuropsych, does anyone have any advice on what type of work experience helps you get in for neuropsych, Matthew?
I think it's kind of similar to before. There's going to be a whole range of stuff that will be beneficial, will be accepted. If you work in multidisciplinary teams, if you're in any sort of public health system, I suppose that would be really beneficial. If you've got work, like even as a support worker, I know a lot of people in our program did a lot of work as support workers for a number of years. People came from research backgrounds. People have come, we've had one person from a clin psych background. So there really is a whole range of related work opportunities that are out there. I think, yeah, if you're in the general ballpark of psychology, neuroscience, there'll be, yeah, that's good. I don't think they'll really be looking for any specific one job that will set you head and shoulders above the rest. I think it's showing some sort of engagement with the field, and showing that you are interested like that, and not just kind of applying on a whim, because yeah, it's a busy program, and so I think they want people there who want to be there, and so being able to demonstrate that through what you've done is a good way of doing that as well. So yeah, people volunteer, like even if it's not work experience, volunteering is a really good one. I know that was told to us a lot in undergrad, that volunteering is a great way to build experience, work out if this is something you might want to be doing. Yeah, volunteering in neuropsych is a little bit less prominent, I suppose. But yeah, volunteering is like Lifeline. This is a great way, nonetheless, of getting exposure, which they look for.
Perfect. Thank you for sharing. So I've got a question that's open to, oh, Isabel, did you want to jump in?
I was just going to say, I just shut down the question a little bit. I could speak a little bit about tips for the interview.
Oh, yeah.
Content.
Yeah, of course. You can't give all the secrets away.
Yeah. Just really similar to what Matthew was saying. And I would just say that obviously you're interviewing, well, for Clin or professional, you're interviewing to be a therapist. That's the end of the training. So just to try and put across some of that, I guess. So trying to show warmth and reflectiveness and curiosity are really important qualities, I think, in a therapist. And yeah, to really reflect on why you would like to be in the degree, and be clear coming across from what are the qualities you think are the right attributes for a candidate, and how do you show them, and yeah, that sort of thing. And to practice with friends, mirror, record yourself and listen, just to practice a lot until you can get it across clearly. And then and then try to be organic. It's just really nerve-wracking. So, but everyone will be fine. Yeah.
Perfect. Thank you for sharing. So a question for, I guess, all of you guys. How did you all find time for self-care when you guys mentioned you were volunteering or working and studying at the same time? How did you guys sort of find that time, or is it easier when you've graduated? Does anyone want to jump in and share a little bit about that?
I guess I'll jump unless Matthew, you have a good answer.
Go for it.
Well, it is very trying. And I know, well, at least for myself, and I'm guessing given the years, some of you experienced it as well, lockdown during part of the master's program, which was difficult. And having a small cohort means that you make deep connections. And that is one of the best things about Macquarie, and what I feel I've heard consistently across all of us here is the connections and the support that you have within your cohort. And I know that faculty and behind the scenes are working at increasing that support network through all the master's psych programs, so that we have even more interconnectedness and can develop those relationships. So for those of you that are coming in, do look forward to that. And I honestly think that Macquarie is absolutely brilliant at that and fostering that, because the faculty have your well-being in mind. We had an entire lecture the first semester saying, you don't need an HD, you're a master's, you need to pass. You need to get to the other end of this alive. You need to get to the other end of this completed. You are enough. You just have to get there. Don't worry about the grades anymore, which was fantastic. We all still worried about the grades, but it's great to know that they don't, it's not that they don't care if you get an HD. It's that that's not how they place value on you and their relationship with you. It is that they want you to learn to the best of your ability and then be able to go forth into the world as a whole human and not a burnt out husk of a human.
I'd really mirror that and probably add that I think there's a lot of hype around the workload and a lot of hype around like, I know some of the things that I was told when I started the degree, you know, you're going in, I don't know, to like trial by fire or like just random things like that. And what I would say is that, you know, none of us have trained to be astronauts. None of us have done metaphysics, you know, like there are other things that are harder. It is hard, but there are lots of other things that are harder, and the hype makes it worse, I think. And yeah, like my self-care strategy, like beyond scheduling self-care, obviously, was head down, get through, which I did, and now I'm out. It's better. Yeah, that's what I would say.
Beautiful. Would anyone
Yeah,
else?
I definitely agree with Isabel. There does seem to be a lot of hype about how hard parts of it are. I remember hearing that quite a bit when I was applying. But at the end of the day, it's a time management thing. It's doable. It's definitely doable. Yeah, if you have that organization to make sure you're putting in the work when you need to put in the work, it's definitely doable. So don't freak out about that now, because it's definitely manageable throughout the degree.
Perfect. Well, thank you very much, everyone, for all of your questions. Sorry we couldn't get to them all, but this does bring our postgrad showcase for medicine and health science to an end. Thank you all to our speakers here and the ones that have been previously for sharing your amazing insights. Thanks, Cath, as well. So for our attendees, coming up soon are our postgrad consultations, and they're running between the 5th to the 16th of June. So it's a perfect way to chat to us if we didn't get to answer your questions, or if you're just wanting to find out more about our postgrad courses. We offer one-on-one consultations where you can chat to our team through the link in your email, or if you want to scan this QR code to book your preferred time slot. And the postgrad team are also available for all your coursework inquiries, and you can contact us on 029850 6791, and you can also email us at our postgrad email. So we very much look forward to supporting your career goals at Macquarie University. Thank you very much. Take care and good night.